Good evening, everyone. Yes, I work with the Napier's Lyme Clinic, and I've been solely focusing on patients with Lyme disease for 3 years now, having come back from doing some training in the States. And, at that time, I realized that just seeing, 6 or 7 patients over the course of the year didn't really give me the insight into the patterns of the illness and the understanding that I needed. So for 3 years now, I have only seen patients with Lyme disease, which has, given me a lot more insight into the condition. So I'm going to share my screen now and get some slides up for you. Here we go. And present. Lovely. Okay, so what I really want to do today is not to talk to you about the specifics of what herb does what and how, but to talk about generally an integrated medicine approach. It's too much in 20 minutes to train you in all the herbs and supplements. So I really wanted to convey what resources you can enlist to better support your patients in an integrated medicine approach. And while I've offered a more formal definition here on the slide, integrated medicine for me is when I, as a herbalist, am able to work with doctors and infectious disease consultants such as Dr. Lambert, contributing to a treatment plan for the best outcome for our patients. Integrated medicine was an area that I focused on most during my master's degree. If anybody wants 33,000 words on herbs and omeprazole, let me know. And it's a fascinating and growing subject. And I certainly, people who did the masters with me are actually employed as herbal medicine liaison practitioners in busy practices in America, where things are being more integrated. But in my practice, I've reached out to patients' GPs with their permission, of course. And I've often found that instead of competition, there can be cooperation. Instead of suspicion, there can be dialogue. And instead of rigidity, there can be open-mindedness. And the end result for the patient is that they get the best of both worlds and a patient-centered route back to health. And I've been working this way for the last 3 years and really wish that all practitioners had the opportunity to practice like this. It helps to understand what's meant by complementary medicine and what's meant by alternative medicine. Perhaps they shouldn't all be lumped together under CAM or other. I most definitely see my discipline, herbal medicine, as complementary medicine. It can be used in many instances as a standalone treatment, but it can also complement the prescribing by medical doctors. With due care taken to potential interactions, herbs can support many of the body's systems alongside prescription medication. And this is particularly appropriate with a multi-systemic illness, such as persistent Lyme disease. And there's a growing body of clinical evidence that supports this as well. Alternative medicine I see as something different. That is more of an alternative to mainstream medicine, and often never the twain shall meet. And these are often disciplines with less or little science or governance behind them. However, the fact that half of the British population uses complementary medicine across their lifetime, really has to be taken into account. So this could be a really big challenge for a lot of GPs, and I fully understand that this modality of working can be challenging, especially given the overwhelming lack of time faced by many GPs and the lack of an official blueprint or template for this. And when a patient comes in with something they've read about online and would like to try, or the name of an unknown practitioner in an unrecognized discipline, it must often feel that to take the line of do no harm is really the best practice. But as I said, half of your patients will probably be using CAM regardless. So you can either dissuade them or ignore the issue, or go that little bit further to educate and incorporate the use of CAM with people that you trust to work with. And in Lyme disease, are these patients any different? I think they are. The challenge for patients is getting tests that are accurate. And if the tests are negative, where do they then go? I've put some statistics up there. 23% of patients consult non-NHS medical clinics. What was interesting was that the Royal Liverpool University Hospital study at the Tropical Infectious Disease Unit, they found 85% of patients in their study had a positive diagnosis based on overseas tests, which would be primarily from Germany and the States. But all were found not to have Lyme disease by the UK National Reference Laboratories. So patients that are faced with this have this dilemma. They are symptomatically identifying with Lyme. They've had tests that are positive, but still the UK National Reference Laboratories, which uses the older ELISA testing, finds them negative. Where do they go then? Very often they turn to complementary medicine. They shop around trying to find solutions. We lack exact data on the UK position, but in America, 95% of patients are diagnosed by primary care physicians, only 5% by their infectious disease specialists. But most patients see more than 4 doctors before they're diagnosed, creating delays that can profoundly affect their quality of life. And to obtain care, 49% travel over 50 miles, 31%, more than 100 miles for treatment. So it's a real challenge. If your patients are going to use complementary medicine practitioners, isn't it better that you embrace it to a certain extent? The diagnostic challenge, of course, with late Lyme is that it really is multi-systemic and the diagnosis is difficult. I always remind my patients that symptoms are produced by the body, not the bacteria. And that as we only have 1 or 2 of most limbs and organs, the body has a limited repertoire in telling us what's wrong. So many symptoms overlap so many other diseases and conditions. But nonetheless, these patients are suffering. GPs are often hamstrung by lack of diagnosis in treating systemically or lack of an NHS pathway for a condition that's poorly described. And with a multi-systemic symptom picture, you could use many drugs simultaneously, yet a high drug load is not desirable in any patient, particularly one without a clear diagnosis. And this is where herbs, which have few side effects when properly prescribed, and by that I mean by a herbalist and not experimented with over the counter, can alleviate many symptoms and improve patients' pain thresholds, energy levels, and their quality of life. Some patients choose complementary medicine just to be heard. And, this is something where my heart really goes out to GPs who are on a tight, 5-minute or 8-minute or 10-minute consultation time. Because after an initial 1-hour intake appointment with a new patient, I so often hear the words, "Thank you for listening. No one has truly listened to me." That they feel that way is not the fault of their general practitioner who has time constraints. In a short appointment, it's not possible to investigate the complex and often seemingly random symptoms that a patient presents with. And as symptom patterns overlap between so many different conditions, Lyme could be many other conditions. And sometimes an infection is only suspected when a patient who's been chronically ill for years suddenly feels better after a short course of antibiotics for an unrelated condition. Referrals to specialists often result in what I call silo medicine, as not all specialist consultants are able to go cross-discipline when patients are atypical. And my patients often come to me with diagnosis of atypical rheumatoid arthritis or atypical lupus. Sometimes it's like patients going off to see a mechanic. They go to their GP who tries to direct them in the best direction. And they go off and the guy looks under the hood and he says, well, it's not spark plugs. And they go, great, what is it? So I don't know, I only deal with spark plugs. And you're sent back to the GP, who then tries their best to get you an appointment with the guy who looks at the carburetor. And the guy who looks at the carburetor says, well, it's not the carburetor. And back you are to your GP. And there does seem to be lacking in the NHS a general medicine practitioners who can stand back and have a overview of all the results coming in from all the different departments. I know that there are general medicine practitioners, but they tend very much to be A&E based and looking at people who are coming in with acute conditions to try to triage them to the right discipline. But, you know, it's badly needed for people with, you know, all sorts of long-term diseases. We don't know what the UK statistics are, but certainly in the America, you know, 72% of US patients with Lyme are often misdiagnosed, and often it takes 2 or more years to correct the misdiagnosis. And, you know, to cap it all, and what makes it most difficult for patients is that over half of them are often classified with a psychiatric disorder, or not believed. You know, you're making it up. You know, this is, you've got too many different symptoms and you're just making it up. So their quality of life is extremely poor, and they rate themselves as having a far worse general quality of life than even people with multiple sclerosis and fibromyalgia. So what do they, you know, where do they end up going? Well, you know, this survey showed that the majority of them will turn to herbal protocols. You know, our experience in our Napier's clinic is actually very similar to this study from my Lyme data, which I think was over 3,000 participants. In the UK, we find that people with Lyme use herbal medicine. They go to functional medicine clinics, which are often very expensive. They use far infrared for saunas, bioresonance, Rife machines, biomagnetic pair therapy, and hyperbaric oxygen all seem to be the most popular. Some have, you know, more effect or seeming effect than others, and certainly none of them should be used as a diagnostic technique, in my opinion, anyway. Why is herbal medicine in particular so popular for treating Lyme? Well, a lot of work was done, you know, going back to, you know, really starting in the late 1990s with Stephen Harrod-Booner and the herbalist Julie McIntyre. He wrote these 3 very in-depth technical books on the treatment of Lyme disease and the co-infections with herbs, as well as herbal antibiotics and herbal antivirals. They ran a clinic together for over 15 years, specializing in the treatment of Lyme disease and chronic bacterial and viral infections, and treated thousands of patients, and also ran an extensive online forum. And these books pioneered herbal treatments that patients initially turned to treat themselves. And they also spawned a lot of the over-the-counter protocols, like the Cowden protocol, which are often very low dose herbs, because, you know, they don't have the professionals to deal with people having reactions or side effects. But, you know, like drugs, you know, herbs are best administered by trained professionals. What then happened after this period was that the herbal medicines that were brought to prominence in treating Lyme were studied for their antimicrobial effects in vitro, and there's been a lot of peer-reviewed studies published. And I just thought I'd show you a couple of pages just of a list. Any of these can be supplied to people who want afterwards. But just so that you understand that there is actually some strong evidence behind what we do. You know, we can show that in vitro cryptolepis or Ghanaian quinine is just as strong as many antibiotics. Japanese knotweed, Chinese skullcap, black walnut, South American cat's claw, Artemisia annua, they're all antimicrobial against Lyme as well, and many of the co-infections. So if you're working with a herbalist, or a patient is being referred to a herbalist, who should you go to? I think a lot of people don't realize that herbalists are actually trained professionals. Most of them will have to have a BS, Bachelor of Science degree or equivalent accreditation. This can take anywhere from, 3 years at full time at university like Lincoln, up to 6 years for people who are doing part-time self-study, plus 500 clinical hours, supervised clinical hours, before people can practice and become part of a self-governing organization. Under the previous Labour government, we were going to be regulated, which many of us, embraced. Unfortunately, once the Conservatives got in, they decided to send us back behind the hedges again. But if a herbalist that your patient is working with is a member of one of these organizations, there are also some organizations for people experienced in Chinese herbal medicine, then you'll know that they do have to meet certain standards, and they have been trained in anatomy, physiology, pathology, diagnostic medicines, diagnostic procedures, and above all, they will do things like ask patients what medication they're on and check for contraindications. So that's really, important. And, why do people, seek professional herbalists, or why is it useful to, if you were part of a big practice, to actually have a herbalist on your team? There are a few practices throughout the UK where they actually have herbalists working in the clinics alongside doctors. And, I've put many reasons up there, but I think, the overriding one is that, we do have more time to actually take a case history, starting at, when were you, when you were born, was it a natural birth? Did you have a lot of childhood illnesses? Very often you build up a picture of people and realize that, their health in some ways was a car crash waiting to happen. And Lyme was what tipped them over the edge, and really didn't help. And tailored protocols are prescribed for patients. It takes a lot into consideration, and also looks at diet and lifestyle and stress. We know that poor diet undermines the immune system. We know that high amounts of stress undermine the immune system as well. So just to give you an idea of, the approach that I take when I'm working, from the detailed clinical assessment, we look at, is there chronic anxiety? So we might get them to start something like autogenic training, which used to be available on the NHS in Edinburgh. I don't think it still is. Are there sleep problems? Let's get the sleep problem. Are there gut issues? Because then they're going to need dietary changes. If the patient has had, a tick bite with an EM rash, it's very clear what is going on. But if not, but there's, suspect Lyme, does the patient have test results? So there's a lot that we'll sort of go through and look at before looking at how we treat. If they're not on antibiotics, we may use specific, antibiotic herbal prescription. They will always be supported for their immune system with herbs that are immunomodulating, not overly stimulating, because Lyme patients tend to have Th1 and Th2 up, and if anything, are more likely to have sort of histamine and mast cell activation type sort of responses. So very much immune balancing, strengthening and modulating with adaptogens, and then pain relief for joints, or calming, herbs that will help to calm neurological symptoms and so on. And we, follow them up. We reevaluate. We see them normally once a month in the first 3 months. And then as they start to improve, go to a sort of 3-month and then eventually a 6-month protocol. But in general, with patients with Lyme, I'm normally seeing them for, 1 to 2 years, I would say 12 to 24 months. If they've been doing antibiotics and have done well on the antibiotics, probably just 12 months afterwards. to make sure that they aren't going to go backwards and relapse. This is a slightly more technical slide that shows you from a published paper a more integrated medicine approach, specifically here to neuroborreliosis. Just to give you an idea of really. I
just texted Rebecca, asked her if she might be free in about 15 minutes.
Okay, sorry. Am I running out of time? What was the?
No, you're fine, Monica. I think we'd interference from somebody's microphone being on, so you're doing fine for time. Carry on.
Oh, all right. I'm sorry. I couldn't quite hear that person. Okay. I just wanted to also talk a little bit about who gets Lyme. Because why some people get Lyme and some people don't is quite a fascinating subject. I analyzed these 15 papers from 1986 to about 2011, where health and safety executives were testing people working in forestry in case there was a big implication for health and safety payouts for people working in forestry. And on average 24% in the UK had antibodies to Borrelia on the ELISA test. So, given the inaccuracy of that testing, probably a lot more people in forestry, have antibodies to Borrelia. So they've been bitten by a tick, but only about, 3.7% on average actually get symptoms. And given that our clinic is in Scotland, and in the last 3 years, we've treated over 1,400 Lyme patients, you would think that our clinic would be full of people working in forestry and mountain climbing and rural pursuits, because, that's what a lot of the ecology of Scotland is. But yet the majority are UK-wide city dwellers with brief rural exposure. And, this is really interested me. And, going back to what I said about, looking at life events, leading up to a car crash in slow motion, I thought I'd give you one example. I had a patient who was bitten at the age of 15, suffered flu-like symptoms and a classic bullseye rash. She was promptly diagnosed and given 3 weeks of doxycycline. She'd always been healthy before then, and the infection appeared to go away. 30 years later, at the age of 45, she'd had a tumultuous relationship breakup following several years of stress. She left her partner and then her home, quit her job, and went traveling. In the Philippines, she was bitten by a mosquito and came down with a malarial type infection, which exhausted her, but she seemed to recover from that. And yet 3 months later, completely crashed and had been wiped out for about 6 months by the time I saw her. An ELISpot blood test showed that she was highly Lyme positive at that point. So it does appear that it was dormant, but kept in check by her immune system for some 30 years, until the lifestyle factors that created the terrain for an off-guard, weak immune system. It reminds me of Louis Pasteur's rival, André Béchamp, who argued that microbes became dangerous when the health of the host, its terrain or its environment was compromised. And while Béchamp was wrong about, quite a few things, his idea that microorganisms are necessary to good health and that beneficial microbiota can become pathogenic under the wrong conditions or in the wrong place is now the standard view of researchers who study the microbiology of animals and plants. Or to quote Florence Nightingale, there are no specific diseases, there are specific disease conditions. So much of Lyme boils down to the status of the immune system at the point of infection. And even when patients have done well on antibiotics, if the immune system isn't strengthened and the underlying factors that led to the immune compromise aren't sorted out, they're likely to relapse. And this is where I feel that herbs and diet can really help patients. So supporting the immune system really is the key. And I find this quote that I put up here by Dr. Jack Weber particularly accurate. we all know that the immune system can be derailed by poor diet, stress, anxiety, post-viral weakness, drugs and alcohol. And many bacterial infections are easily identified and eliminated by the immune system, but for some patients, acute and chronic infections cause a dysregulated immune response. And Lyme in particular undermines the immune system in its attempt to evade it. So a disruption of any of the body's systems can have a really negative impact on the quality of life for patients. And herbs, nutritional support, counseling, dietary advice, life coaching, and other natural methods can help to promote their immune health and provide support for the long haul. Lyme is also a great imitator. I find that, some of the arguments about whether or not someone has Lyme is because there are so many overlaps with other conditions. And many patients come with multiple diagnoses of other conditions. Now, it's not really a question of either or, but sometimes of and as well. Because, Lyme, initiates and triggers conditions, particularly autoimmune thyroiditis, for example. It aggravates, many others and amplifies other things. I have a twin patient in Spain who consults with me, and both she and her twin have inherited Ehlers-Danlos syndrome. And what is so interesting is that the twin with the infection, with the Lyme infection, has been so much worse than the twin who doesn't. And that's only since the infection, because up until that point, they both were symptomatic in the same way. I also find that in some patients, short-term or long-term antibiotics can make a world of difference. Some people literally get their lives back from being bedbound for years when they have long-term antibiotics. But others, they don't help as much, or they only go so far and the patient's improved, but still symptomatic. And this is very often when another condition has been triggered that's running alongside the Lyme and still needs to be treated as well. So a lot of what we do in the hours that we spend with patients is teasing out the symptom patterns to help identify when patients have other underlying or concurrent conditions that need additional treatment. And, I do think sometimes that, the patients start off with Lyme, and that the antibiotics do kill the bacteria. But because of the damage that's been done by Lyme to them, they don't, get as better as they can. I have one patient in Ireland at the moment who, when he came off a long-term course of antibiotics, had improved somewhat, but still didn't feel that he could get to the bottom of his garden gate and back to the house without having to go and have a lie down. And he'd given up all hope. He's now not only climbing mountains, he's just doing his course as a mountain leader. And, says that, 7 years ago, he couldn't even have dared to hope that he would ever get past his garden gate again. And that all came about, after he'd come off the antibiotics. And I'd been treating him for 6 months before we found the right combination, or before his body finally started to catch up and review, and get strong too. So, I'm happy to, continue the dialogue and, at another time to go much more into detail about the herbs. But, I know that you're all busy, and, herbal training is something that's, possibly you're not going to be able to undertake, but there are people out there that you can work with. So I just wanted to thank you for listening, and just to also suggest 3 extremely good books, particularly the one by Dr. Daniel Kinderlehrer, Recovery from Lyme Disease, which I think they're not books about herbal medicine, they're just books that are incredibly important for GPs. Thank you.